Hi, I'm Dr. Leigh de Clifford. I'm the Technical Service Veterinarian for Contura Vet, and I've been working with Arthramid for roughly 12 years now. I've been involved in multiple studies on the product, and that spans multiple countries and jurisdictions in both racing and equestrian horses. For me, Arthramid has been a complete game changer in how we manage osteoarthritis in my patients, as it's got a unique mode of action that's long-lasting and has very few side effects. So I use Arthramid Vet for the exclusive management of osteoarthritis in my patients, and my criteria for selection for those individuals to be treated with the product are a degree of lameness, and that doesn't necessarily need to be an obvious asymmetry, because obviously quite a few lame horses present to you that are actually bilaterally lame in either the contralateral joint or another joint on the contralateral limb. So it's any horse that's got an abnormality in movement of the gait, even behaviour as they're in motion, but also my main criteria for patients that are an appropriate case for Arthramid are ones in which have synovial effusion, reaction deflection, but then also that they have a positive response to intra-articular analgesia. In conjunction with a positive response to intra-articular analgesia, along with the clinical signs, I would always do imaging of some description, and that ranges from ultrasonography, radiography and advanced imaging such as computed tomography and MRI. And you can also incorporate PET scans and nuclear scintigraphy if required for the overall workup of the horse. So I use Arthramid in the treatment of osteoarthritis, and I use it exclusively on its own, depending on the case, but also at times with a mixture of both systemic non-steroidal anti-inflammatories, corticosteroids, but also on occasion intra-articular corticosteroids, as you need to manage the severity of the horse, the disease that it's affected by, but also the performance program of that individual. And as a result of Arthramid taking 2 to 4 weeks to fully have effect, there are times where the disease process is so severe and there are time constraints that you do need to use other alternative products in the beginning. Where possible, I try to use Arthramid exclusively in the management of my patients. Some joints are quite severe, and we do know that the more quiescent a joint is on administration of Arthramid, the quicker, better and longer lasting result you'll get, which is why where possible I try to administer it as early on in the disease process as possible. In addition to that, the dose that you administer into each individual joint is dependent upon the joint, as size varies greatly amongst joints, but also the disease severity that you're administering into, where the more severe disease processes that you're managing require a larger dose, and sometimes they require a repeat dose at roughly 4 to 6 weeks. So after the administration of Arthramid into the joint, I rest the patient for 48 hours, and in that time they can go on a walker, they can be hand walked for 10 minutes twice a day, but it is just allowed the product to permeate through the joint and make contact with the synovium to start the process of integration within it. The management of the individual after that is dependent upon the discipline, the joint, the severity of the disease. One of the key benefits with Arthramid is the longevity in the response that you get to the product. And this ranges from approximately 234 days out to several years, depending on the patient and the severity of disease and how the patient is managed post-administration. As with any other intra-articular injection, the administration of the product follows key principles of appropriate restraint of the horse, including sedation and staff that are capable of holding the horse while you're performing the procedure, sterile technique, and I quite like using a 21 gauge needle because the product will invariably not be able to be pushed through a 21 gauge needle if you have it outside of a synovial cavity. So it's a good way to ensure that you're in the joint, but also other techniques of having a sterile syringe of saline that you can inject into the joint first to ensure that you're in there first of all, but also other modalities such as ultrasonography, in particular for stifle joints, where you can make your assessments first, locate your landmarks, place a marker on the skin and then inject once you've used the ultrasound to get your landmarks.